Hi, spectators. I am Dr. Venkata Rama Kumar. Today, I will be talking about the common endocrine cancer, which is thyroid cancer. Thyroid cancer develops in your thyroid gland as a part of endocrine system. Your thyroid gland produces hormones that regulate body temperature, heart rate, and metabolism. Most thyroid cancers are highly curable. That's the good news about it. Treatments include surgery, chemotherapy, radiation, hormone therapy, and radioiodine therapy. I will explain in you what is thyroid cancer. Thyroid cancer develops in your thyroid, a small butterfly shaped gland at the base of your neck. This gland produces hormones that regulate your metabolism. Metabolism means how your body uses energy. Thyroid hormones also help to control your body temperature, blood pressure, and heart rate. Thyroid cancer, a type of endocrine cancer, is general, highly treatable with an excellent cure rate. That's the good news about this cancer. How common is thyroid cancer? Close to 53,000 Americans receive a thyroid cancer diagnosis every year. Treatments for most of thyroid cancers are very successful. Still, about 2,000 people die from the disease every year. Women and people assigned female at birth are three times more likely to get thyroid cancer compared to men and people assigned male at birth. The disease is commonly diagnosed in women. What are the types of thyroid cancers? Healthcare providers classify thyroid cancers based on the type of cells from which the cancer grows. Types of thyroid cancer include number one, papillary. Papillary, up to 80% of all thyroid cancers are papillary. The cancer type grows slowly, although papillary thyroid cancer often spreads to lymph nodes in your neck. The disease responds very well to the treatment. Papillary thyroid cancer is highly curable and rarely fatal. Next is follicular thyroid cancer, accounts for up to 15% of thyroid cancer diagnosis. This cancer is more likely to spread to your bones and organs like your lungs. Metastatic cancer may be more challenging to treat. And third one is medullary. About 2% of thyroid cancers are medullary. A quarter of people with medullary thyroid cancers have a family history of the disease. So, if you have a family history of this, we have to be careful. A faulty gene, that is genetic mutation, may be to blame. And another one is called anaplastic. This aggressive thyroid cancer is the hardest to treat. It can grow quickly and often spreads into surrounding tissue and other parts of the body. This rare cancer type occurs for about 2% of thyroid cancer diagnosis. So, what are the thyroid cancer stages? So, till now we discussed about the types, then now we will talk about the stages. Healthcare providers use a staging system to determine if and how far thyroid cancer has spread. Generally, when cancer cells in your thyroid metastasize, that is, when they spread to your nearby structures and lymph nodes first. After that, the cancer can spread to distant lymph nodes, organs, and bones. So, thyroid cancer stage from 1 to 4. In simple terms, the higher the number, the more the cancer has spread. Okay, what are the symptoms of this cancer? We have to remember what are the warning signs of thyroid cancer. You or your doctor might feel a lump growth in your neck called thyroid nodule. Don't panic if you have a thyroid nodule. Most nodules are benign. Benign means they're not cancers. Only about 3 to 20 thyroid nodules turn out to be cancerous. Other thyroid cancer symptoms include difficulty breathing or swallowing, loss of voice, that is hoarseness of voice, and swollen lymph nodes in the neck. These are all the symptoms of thyroid cancer. What are the signs of thyroid cancer? Whether it has spread. If you have thyroid cancer that has spread to other areas of body, you may experience symptoms such as tiredness, loss of appetite, nausea and vomiting, unexpected weight loss. So if you have these things, then we may have to think that it has spread. So what causes thyroid cancer? Experts are not very sure. They're not very sure why some cells become cancerous and attack your thyroid. Certain factors such as radiation exposure, if you have a history of radiation exposure, a diet low in iodine and faulty genes can increase the risk. Other risk factors include enlarged thyroid, family history of thyroid disease or thyroid cancer, thyroiditis, that is inflammation of the thyroid gland, gene mutations that cause other endocrine diseases, low iodine intake, obesity, radiation therapy for head and neck cancer, especially during childhood, exposure to radioactive fallout from nuclear weapons. So, how they diagnose cancer? This first, if you have an enlarged thyroid nodule or other signs of thyroid cancer, your doctor may order one of these tests. Blood test. A thyroid blood test checks the hormone levels, gauges whether your thyroid is functioning properly. Biopsy. During a fine needle aspiration biopsy, your doctor removes cells from your thyroid to test for cancer cells. A sentinel node biopsy can determine if cancer cells have spread to lymph nodes. Your doctor also use ultrasound technology to guide these biopsy procedures. And radioiodine scan. This test can detect thyroid cancer and determine if cancer has spread. You swallow a pill containing a safe amount of radioactive iodine. It is called radioiodine. Over a few hours, your thyroid gland absorbs thyroid iodine, and your healthcare provider uses special devices to measure the amount of radiation in the gland. Areas with less radioactivity need more testing to confirm the presence of cancer. And there are other scans like imaging scans, radioactive iodine scan, computer tomography, positron emission tomography, PET scans can detect thyroid cancer and cancer spread. So these are the tests by which doctors can decide. And management, how thyroid cancer is managed or treated. We will see that. Treatments for thyroid cancer depends on the tumor size, whether the cancer has spread. Treatments include surgery. Surgery is the most common treatment of thyroid cancer. Depending upon the tumor size, a surgeon may remove a part of your thyroid gland, it is called as lobectomy, or all the gland, that is thyroidectomy. The surgeon also removes any near lymph nodes where cancer cells have spread. Radioiodine therapy. With radioiodine therapy, you swallow a pill or liquid containing a higher dose of radioactive iodine than what's used to in a diagnostic radio. So I told you earlier about that. And the radioiodine shrinks and destroys the diseases, thyroid gland, and with cancer cells. This treatment is very safe. Your thyroid gland absorbs almost all of the radioiodine, rest of the body has minimal radiation exposure. And you have radiation therapy also. Radiation kills cancer cells and stops them from growing. External radiation therapy uses a machine to deliver strong beams of energy directly to the tumor site. International radiation therapy involves placing radioactive seeds in or around the tumor. Then chemotherapy. Intravenous or oral chemotherapy drugs kill cancer cells and stops cancer growth. Very few people diagnosed with cancer, thyroid cancer, will ever need chemotherapy. Chemotherapy is rarely used. Hormone therapy. This treatment blocks the release of hormones that can cause cancer to spread and come back. What are the complications of thyroid cancer? Thyroid cancer can spread to other parts of the body, such as your liver, lungs, or bones. Detecting and treating thyroid cancer in early stages reduces your risk of metastasis. So earlier you get diagnosed and get treated, it is better. Thyroid cancer can recur even after treatment. Because the thyroid cancer grows slowly, it could take up to 20 years to come back. Recurrent happens in up to 30% of the thyroid cases, so one third. And overall thyroid cancer prognosis is positive. So the good news is it is positive, but it is important to know that after thyroid surgery or treatment, your body still needs thyroid hormones for function. So your body needs thyroid hormone, you will need thyroid replacement hormone therapy for life. Synthetic thyroid hormones like levothyroxine takes over for thyroid hormones that your body no longer naturally produces. So, and is there any prevention strategy? So, I will tell you about prevention also. Can I prevent thyroid cancer? Many people develop thyroid cancer for no known reason, so prevention isn't really possible. But if you know you are at risk of thyroid cancer, you may be able to take these steps. Number one, preventive surgery. Genetic tests can determine if you carry an altered gene that increases the risk of medullary thyroid cancer or multiple endocrine neoplasia. And if you have a faulty gene, you may have to have preventive surgery. And potassium iodide, if you had radiation exposure during nuclear disaster, that is, they can give that. And prognosis, so 8 of 10 people who have thyroid cancer develop a papillary type. That is the most common one. Papillary thyroid cancer has 5-year survival rate of 100% when the cancer is in the gland, it is localized. Even when the cancer spreads, the survival rate is close to 80%. This means that an average about 80% as likely to live for at least 5 years after diagnosis, someone who doesn't have metastatic papillary. So these are all the things, and 5-year survival rates for other thyroid cancers include follicular, close to 100% for localized, and around 63% for metastasized, medullary, close to 100% for localized and 40% for metastasized, anaplastic, close to 31%. So let us know whether cancer is curable. Yes, almost most thyroid cancers are curable with treatment. You remember that, especially if the cancer cells haven't spread to distant parts of the body. Treatment doesn't really cure thyroid cancer. Your doctor, provider, or healthcare provider can design a treatment plan to destroy as much of the tumor as possible and prevent it from growing back, spreading. So remember, and if you have a swelling in the neck, and consult your doctor and take healthcare providers' help to diagnose it early. As we discussed, if we can diagnose early, we can give better treatment. Take care. Thank you. Your Dr. Venkata.